And the great thing that we are able to do with colonoscopy most of the time is we can remove those polyps either when they're very small early cancers. Sometimes we've completely cured the cancer, and in other cases we're able to actually prevent cancer. So colonoscopy is not only screening but prevention.
Today we're talking about colon cancer, what it is, what it's not, screenings that are available today, what has changed throughout the years, and why it is one of the most preventable cancers. Joining me today is Dr. Noelle Bertelson. She is a colorectal surgeon with Intermountain Health. She practices at our own St. Joseph Hospital. Dr. Bertelson, it's great to see you, and thanks for coming in.
Thanks so much for having me here.
Tell me a little bit about yourself. Why did you get in this field in particular?
I come from parents who are physicians. My mother is a physician, so that's what led me into medical school. I decided to do general surgery, and then had a lot of exposure to colorectal cancer care and inflammatory bowel disease, and those became really my passions and led to my fellowship training.
That's great. We'll start with the real simple stuff. What is colon cancer?
So colon cancer is essentially a slow disease process that starts typically for most patients as polyps. Polyps are sort of disorganized cells that slowly grow over time and become more and more disorganized until they start to invade. And that's when they have the risk of becoming metastatic, and that's when they truly become cancer.
That's why it's so important to be screened. It is one of the most preventable cancers that's out there right now. And there's a lot of different treatment options, but let's talk first about screening. What is most important about screening guidelines that I should know as a patient, a consumer?
Sure. So I think the most important thing is that an average risk patient, which is someone with no family history or no other disease risk factors, get screened starting at age 45. That's the current recommendation. There are a lot of different screening modalities that we can talk about. And then your physician will make recommendations based on the findings at that time of when you have to come back and get it done again. So
I'll be a little vulnerable. And in my last screening, I think they found 3 polyps. One of them was cancerous. And I will tell you, when you hear like, hey, guess what? Congratulations, you've got a little cancer. But it was scary at first, but not anything to panic about. And our physicians do a wonderful job, by the way, of kind of calming you down and explaining the whole thing. But would you agree with that? Like, look, don't be, terrified if you do happen to find a polyp. That's why we're doing these screenings.
Yeah, I think the great thing about colonoscopy, and our GI doctors do a great job of high volume screening. We also do screening at St. Joseph Hospital from the surgery department. And the great thing that we are able to do with colonoscopy most of the time is we can remove those polyps either when they're very small early cancers. Sometimes we've completely cured the cancer, and in other cases we're able to actually prevent cancer. So colonoscopy is not only screening but prevention. So
to prevent, you've got to get screened. That's really, and diet and things like that. We'll talk about that in a minute, but let's talk about the screening process. In my experience, I did not want to get a colonoscopy because of the screening process. The first time it's a little scary, I got to be honest with you, and you hear about all the prep that goes into it, and like, oh my gosh, I'm going to be wiped out. I got to take off time from work. Let's walk through the process. Let's start with the prep. What does that look like?
So the prep, for most people, they are doing a lot of split preps, meaning you have to do part of it at night and part of it in the morning before you go in. Some people will do the entire prep the evening before. It depends on what your instructions are and what you need. I think the most important thing is to stay well hydrated, because when people stay well hydrated, they actually really do fine. Yeah. So I think it's be smart about what you choose to drink with your prep, and then most people will do very well with it.
I prefer Gatorade.
Coconut water, actually.
Coconut water. I'll have to try that next time.
Yes.
So we'll get through the prep. It's not that big of a deal. Mm-hmm. It is a little uncomfortable maybe for some people, but really, it depending on, as you pointed out, you can get through it just fine. Then we go to see you. Mm-hmm. And how does that process work?
So you roll into the hospital, get checked in, meet the doctor. They go over the risks of the colonoscopy, which are fortunately very, very low risk procedure. And then you get to drift off to sleep, wake up, don't remember anything, and go have a hamburger.
Or a milkshake.
Or a milkshake.
And break out into show tunes. We were
Yes.
talking about that, which I have done, and some people do.
Yes.
It is a time where you just kind of lose all inhibitions, and it's a great little nap. And it doesn't take very long, right? Tell me about
Correct. For most patients, it's a 20-minute procedure.
that. Yeah. After the procedure, there is a process that goes through to kind of end up the screening and to ensure that if you've got polyps, that they were removed. Are they cancerous or are they not? Walk me through that process and how long that takes.
So if we do wind up doing any biopsies or polypectomies, removing any polyps or doing biopsies of something that looks suspicious, that goes off to the pathologist. The pathologist typically can turn that around very quickly, especially for things that we're concerned about. So most of the time I have results back within about 3 business days or less, and I'm able to then get a phone call to the patient to let them know, hey, nothing to worry about. Here's when you're due next. Or here are the next steps if we did find something concerning.
Yeah. And typically, how long is it between screenings? If they find nothing, is it every 5 years or 10?
It's 10 years if you're screening with colonoscopy.
And if they do find something, they may want to decrease the screening time.
Yeah, it really depends on the size of the polyps and the type of polyp. So a very small polyp, we'll still recommend 10 years because that risk is so low and polyps turn into cancer over such a long period of time. Yeah. Patients with large polyps or multiple polyps will recommend coming back in 3 years or sometimes even sooner.
And they send you little photos too, which is kind of cool. Yeah, you can frame those, put them up on the wall maybe.
Right, very exciting. Christmas cards.
Well, doctor, that would be really fun. I hadn't thought about that. Besides colonoscopies, there are a lot of in-home screening tools as well. And now talk a little bit about those and who they're for and maybe who they're not for.
So the gold standard is still colonoscopy. It is the best option we have because it's preventative by removing polyps, not just screening. But in my mind, I think, and in general in public health, we would agree that any screening is better than no screening. And so the 2 most common options that you'll see are FIT, which is fecal immunohistochemical testing, which is just a stool sample. You do it at home, you send it in, mail order, and they're checking typically for blood or blood products in the stool, and then that will trigger a colonoscopy if it's positive. The other are the fecal DNA testing. The most common one that we see is Cologuard, and that one actually tests for DNA demonstrating changes that would indicate colon cancer or polyps. The Cologuard testing is recommended every 5 years, and FIT testing is typically every year.
We have seen a lot of headlines recently about younger adults being diagnosed with colon cancer. And in some cases, they are not getting screened at a young age. Talk a little bit about why we're seeing younger diagnoses and what advice you might have for someone who's in that age range.
So I think we certainly know that colon cancer is one of the fastest growing or fastest rising incidences of cancer in the population under the age of 50. And we're certainly seeing that the age group under age 45 are presenting with very advanced cancers typically. We don't really know why. It's probably a lot environmental, the foods we eat, genetic predispositions. Most 20% of people who show up with a cancer at a young age have a genetic syndrome that's predisposing them to cancer. But that means there's still 80% of those people are showing up with no reason and no indication. So I think it's the most important thing is those young patients, if they have bleeding, if they're having new onset abdominal pain or changes in their bowel habits, or anything that just seems new or different for them, that they should go into their primary care doctor and get things checked out. And if they're really worried, kind of put the pressure on to get screened.
You do need to be your own advocate sometimes, right?
Absolutely.
As much as we respect and honor you, Dr. Bertelson, we need to push back sometimes or push you to do something, right?
Absolutely.
When someone is diagnosed with cancer, as I mentioned earlier, I mean, just from my own perspective, it can be a little frightening. You just don't know what's going on. What advice do you have for someone who may hear that after a colonoscopy?
One of the things I tell patients is that colon cancer is one of the most common cancers in the United States, which means that we have lots of experience treating it, and it means that we're really good at it. And so while it's a scary diagnosis, most cancers are treatable when we catch them. And the treatment for colon cancer is very well tolerated. Most people ask me, am I going to lose my hair? And the answer is no.
Yeah.
And that's just a marker of their anxiety and what they've seen on TV. And fortunately for most patients, they can work through their treatment. The surgery for colon cancer is incredibly advanced, and people are in the hospital for just a day or two most of the time. So I think that it's something that we've gotten really good at taking care of, and people do really well with.
They do. And just for the record, to be transparent, I've lost my hair, but it had nothing to do with colon cancer. So just wanted to be very upfront about that. Let's maybe talk a little bit about why this is such a difficult conversation sometimes to bring up. I mean, I will just tell you that I don't hear many people saying, let's go get a colonoscopy today. Won't that be fun? Or let's talk about colons. But it is important because this, again, is most treatable, but you got to catch it early.
So I think that people are nervous. It's kind of one of those a little bit more taboo parts of the body. It's something that a lot of the actors and media personalities are becoming more and more outspoken about, which I think is important. Unfortunately, this is like an awkward area to talk about, but it's really important. And so I think that just kind of letting yourself move past that. And as a physician who deals with this all the time, every day, people are nervous when they come in and talk to me. I probably won't remember your face, but I might remember your colon.
Really? And you're awfully fun at parties too.
Very, very.
I'm just saying. So it is one of those things. It is what it is, and it's just really important to get into address it and not be overly concerned. You see it every day.
Right.
What is the most important point you want our audience to take away from this conversation?
Yeah, I think if you know that you have risk factors, so family history or concerning symptoms or a genetic predisposition, certainly you need to be thinking about screening very early. Talk to your doctor a very early age, so talk to your physician about that. But certainly if you've hit that age 45, really just get in and get screened. It's so important, and it's a lifesaver.
Before we wrap up, we like to end every one of our episodes on a positive note. And there is a lot of positivity. You've talked a lot about that in our time together, but just kind of encapsulate it for me. What gives you hope and positivity about this type of cancer?
There is so much research and technical advancements. Immunotherapies are coming out on a very frequent basis that are giving us these amazing treatment capabilities for patients. The surgery is getting better and better. And so I think that and our screening modalities are getting better and better. Patient tolerance is getting better and better. And the willingness for people to get screened and access to screening is getting better. So I think that we're really making a lot of continual advances in this field. And maybe someday we'll even be able to completely eliminate it.
Let's do it, shall we?
Yes.
Thank you for being here. It's encouraging. It's empowering. And this really is a cancer where knowledge can help you live the healthiest life. So we appreciate you. Thank you.
Thank you.
And you are really fun at parties.
Absolutely.
So join us next month on Your Healthiest Life, where we will be discussing orthopedic health, the diagnosis, treatment, and prevention of joint and ligament injuries. And of course, as we're transitioning from winter, for what we can say we've had winter, sports to spring sports to summer sports, I guarantee you this is going to be a very worthwhile topic. So we'll look forward to seeing you then. And you can visit, of course, intermountainhealth.org anytime to learn more about today's topics or any of the topics that we've discussed in the past. And you can also subscribe on Spotify, Apple Podcasts, or watch the video version on the Intermountain Health YouTube channel. Thank you for listening. We appreciate you being here, and thank you for living the healthiest life possible.